AQG is a tool to help surgeons better understand the outcomes relative to their peers, both within their own health system as well as across the country. It's this real-time, continuous quality assessment that will benefit our patients moving forward.
It's something very novel and in fact leverages some of the machine learning techniques that we have today to be able to provide institution-specific risk modeling for patients, for surgeons, for hospitals and their administrators.
We wanted to focus on a database dealing with specifically quality and that we could act upon immediately.
At my institution, we're involved and excited because we see the future of quality improvement in cardiothoracic surgery being in more granular data that's procedure and surgeon specific. We also need real-time data and not data given to the surgeons every 6 months or even longer.
We need quality on an individual basis. I need to be able to look for my patient and tell them what the risks are. I need to be able to look at my entire service, find out where the problems are. I need to be able to innovate and see if it had impact. That nimbleness of being able to really change what I do on a day-to-day basis is where we need to get to, and one of the central tenets of AAQG.
So if somebody, let's say for argument's sake, is having a high stroke rate and happens to be doing a lot of patients off pump, well, then the question is that the way to go? And so those kind of things, having the data is very powerful because you can then act on it.
The AQG was built as a modular database, and what that means is that there are specific portions of the database that can be available for different purposes. The cardiac and thoracic base modules really are the core of the database system. But each individual hospital or hospital system can decide to participate in other modules that we are developing. For instance, we're planning on developing an operations efficiency module that will allow hospitals and their administrators and service lines to capture the efficiency of their program. We will also have a research module for other institutions interested in doing particularly clinical research from the database. The modularity of the AQG is critical, and it is something that is very different from the current registry we have.
I think AQG is going to be really important in thoracic surgery. We are very interested in longer-term outcomes because we have cancer and what's the recurrence. We need to know what are the different therapies. Should we do them in earlier stage disease? Do we need to think about things, operative risks if you do immunotherapy, for example? And so the ability to incorporate those, to do these research questions becomes really important in thoracic surgery, and that data is not available for us to collaborate across the country and to collaborate between programs.
I am particularly excited about the modularity and flexibility of AQG and its ability to allow collaboration in multi-institutional prospective cohort analyses. I believe this is going to transform how we represent outcomes in current practice, using novel analytics with the ability to generate large patient cohorts in a rapid and prospective fashion.
We've seen a rapid adoption of the AQG across all sizes and shapes of hospital systems. They all recognize the advantages that this database will have not only for their patients, but for their programs and in fact, for the profession. If you're interested in participating in the AQG, just scan the QR code and that'll lead you to more information on the product.